See, I'm not as quiet as after that, so I'm a country girl, so I hope you can hear me in the back. For all of us, for poor people who have a little trouble hearing, I like to talk loud. So if it gets too loud, just let me know. So this is always such a special occasion, and Antoinette has already said, how wonderful it is to have each one of you present with us today. But I want to add to that, because as I look out to you, I thought when people talk about diversity, they should come to one of these celebrations. It really is a picture of diversity, and what a beautiful bouquet they represent of all of us. So, you've heard we've been in existence as of July 65 years. And so we are blessed to have 3 of our founders still living. And we're so blessed today that one of our founders is with us, Ms. Pitts. Come forward. They're not able to be with us today, but we're so grateful to have them a part of us who continue to guide us, mentor us, and tell us what we should do right. And we have to listen. Ms. Pitts is one of those first 13 women. And just think, for all of us who talk about how tired we are, how difficult it is, Ms. Pitts is an example. What helps us to understand what hard work and hardship, it does not detract from our ability to be successful and to live a long life. That's what she's done. Ms. Pitts was one of the 13 women who helped us get this started. She graduated from Jackson, Florida, and came to Seattle and went to the University of Washington in 1952, where she received her Bachelor's of Science in Nursing. She did this as a single mom and working full-time. So all of you who are going to school, we're so honored to have you with us and also to continue to mentor us and guide us in this organization. Thank you very much. So Ms. Pitts and my president is going to help you with the Ann Ford Baker Award. And I'm going to kind of stick to my notes because I've been told I have a short amount of time. And you all know who know me, that if I didn't talk, you never know. But, as I thought about this award, and as I thought about Ms. Pitts participating in this today, I don't know how many of you have read the book, Warmth of Other Suns. But if you haven't, you should read it. It gives you a lot of our history, but most importantly, it sheds a lot of light on some of the things that are happening today. And as I thought about Lois Price Stratton, who was one of our members who we lost a year ago, who wrote the book on the struggle of African American nurses. I can't remember my plot. Anyway, I thought Lois didn't know, but that really is the discussion about nurses' warmth of other suns. And so I would encourage you still, if you haven't read that, to read it, because it is about the struggle of African American nurses in Seattle and some of the challenges they have, but most importantly, that contribution to nursing into this community. So people know I like to get off August 1st. I want to start preaching, y'all. So anyway, I just have to get that in. Anyway, the N4 Baker Award highlights another mission of our organization, which is community service. Ms. Baker was one of our founders who believed that nursing was a calling to serve, similar to being called to become a minister. She believed that we have an obligation to serve those who committed to our care and to provide services to our community. She demonstrated this throughout her life, on until her death. Therefore, members of the Maryland County Professional Nurses Organization have continued that tradition. We have collaborated with a variety of organizations. For example, African American Reach can teach in the HIV and AIDS Project, and most recently, and the Affordable Care Act to rescue people who have a need for health insurance. King County Nurses Associations to help screen people on hypertension and health education. We also provide monthly barbershop and beauty shop blood pressure screening and health education. We work with that in collaboration with the American Heart Association. We collaborate with Premier Blue Cross and Blue Shield on blood pressure screening and health teaching. We've collaborated with Northwest Center on their annual health fest and many other health organizations. Currently, one of our great focuses is trying to help people and educate people in our community about the Affordable Health Act, so that people who really need health insurance can get there. So if you know somebody who needs health insurance, tell one of these nurses and we'll get you to the right place. These partnerships have allowed us to broaden our work and include our students in this effort, so they will better understand the mission of caring through community service and continue the legacy long after all of us are gone. So each year we remind ourselves of the value of these collaborations through honoring a community organization or person who has supported our mission, who are committed to service and demonstrated the calling of the community. I think that each one of your presence here today reflect your commitment to serve. This year, the person we've chosen to receive this award is Dr. Maxine Hayes. Dr. Hayes. She received numerous awards and recognition throughout her career and has served on many policy groups, nationally and internationally. Most recently, she retired from our state as a state health officer after 16 years. Dr. Hayes has been an early adopter and a leader in many arenas of health and civic services. Of particular note, she developed and created an urban health clinic in a manpower shortage area in Rankin County, Mississippi in the 1970s. This clinic integrated dental care in the health plan. It allowed for the welfare program and the health services program to reside in the same location. This was the first clinic of this kind in the state of Mississippi, and it has served as a model for future clinics, not only in Mississippi, but nationally. In the early 80s, she served as pediatric advisor to the Mississippi State Board of Nursing. She helped develop protocols for pediatric nurse practitioners throughout the state and participated in the education and preceptorship of nurse practitioner students. Her encouragement of others to expand the use of nurse practitioners have fostered the integration of this role in health services throughout her career. Upon her arrival in Washington State, she served as medical director of the Odessa Brown Clinic. This is a clinic that provided services for the low-income population. During this time is where she and one of our former members, Elizabeth Thomas, worked together to ensure that the services to families were improved. She led our state in the tobacco cessation program. She co-led the state efforts in eradicating smoking. In all of her efforts, she is constant champion to focus on all populations to ensure the underserved is not forgotten in our target effort to eradicate smoking. During the state's effort on managing chronic disease, she was a constant champion on creating systems and targeted groups to focus on prevention. Her efforts were directed not just at traditional needs, but focused on partnering with community groups and efforts to ensure that the problem was focused on at the level where people reside. We continue to use her picture as we do our blood pressure screens in Barbara and Beauty Shop. She is the poster lady for our efforts. Dr. Hayes has clearly focused her life work on children, families, women, prevention, populations, diversity, and the underserved. If you review her early publications, you can see where she's discussed the issues of cultural competence and social determinants of health way before they became the new language in healthcare. She understood the impact of these upon populations, and not only did she lecture on them, but you will see how she ensured that these principles were integrated in policies early in her career. On all of her success and numerous awards, I'm sure we asked Dr. Hayes, what was she most proud of? It would probably be being a mother and a wonderful daughter. She's been tireless supporter of American Honey Professional Nurses Organization's mission. She's been here and spoke at many of these occasions. She's a leader in the community, in the country, and internationally. And we're proud to bestow upon you the Ann Ford Baker Award because of your service to humanity. In the words of Savior Ravon, and I quote, "I'm not a special person. I'm a regular person who does special things. You are phenomenal." Thank you very much.
Ended, and at the end of the ceremony, please basically check outside to see if you won one of the silent auction items. She changed her mind, she has a few words to say.
Well, I think it's only fitting to say to God be the glory. It has truly been a blessing to serve, and I will continue to serve public health and support you as an organization and all that you do. And I'm so, I don't know, I'm really overwhelmed. And I just thank you so much for this recognition. But to God be the glory, and have a wonderful week.
Becky Manning will announce our scholarship presentation.
donors to come forward.